So TMD often presents with pain in and around the ears or clicking. Clicking is present in around about 30% of the population, and in itself, it doesn't need any treatment. It's caused by the cartilage disc in the joint being displaced forward by regular pressure on the joint. The surfaces stretch and the disc slips forward. The tissues behind the disc adapt to that. They are not as tough as the disc, so they can cause pain in the joint and get inflamed. Whereas the disc doesn't have any pain fibers, it doesn't have any blood supply. The tissues behind it are softer and are more likely to get inflamed. And it's a little bit like a sprain in the joint. When you get a sprain in the joint, you get pain in the joint, which is just in front of your ear here. The muscles around the joint will contract. So the muscles here will contract and put more force through the joint, causing more joint inflammation and pain. That can cause more muscle spasm until the muscles around the joint are aching. Or it may take the other way around. The muscles may start aching first, and they're putting more pressure on the joint, and you're in this vicious cycle of joint pain and muscle pain. So when you go to see your dentist, they will need to do a general examination of your jaw and the muscles to see whether there's joint pain and whether there's muscle pain. Initial management can be by following the information leaflet, which you can download from my website, andrewsidebottom.co.uk, and that involves rest of the joint, which basically means stop eating sticky foods, avoid sticky toffees, chewing gum, things like that. If you need to go to the dentist for visits, multiple short visits, or if they can give you breaks within the visit every few minutes to allow the jaw to relax during that visit. Second thing is muscle massage. So you'll feel areas of muscle spasm, which will feel like you're running your fingers over a speed bump in the muscle. You should massage those areas firmly for 1 minute, 4 times a day. The third thing is if you've got pain in your joint, which is just in front of the little knobble in the middle of your ear, you slide your finger down forwards in front of that and open and close your mouth, you'll feel the jaw joint. You rub anti-inflammatory gel into that gap with your mouth open about 2 centimeters 4 times a day, and that will help to relieve joint pain. The final thing, your dentist needs to make you a bite splint. That can be either upper or lower. It can be either soft or hard, but it must cover all of the teeth, because limited splints, which just cover the front teeth, can cause changes in the way your teeth are biting together, which can be permanent. And you should wear that splint at night. So self-management of TMD I've discussed in the last question, which is rest of the joint. So avoid sticky toffees, chewing gum, crusty bread. Massage the muscles for 1 minute, 4 times a day, and apply anti-inflammatory gel over the joint 4 times a day, and then wearing the bite splint at night. One of the other things that's very important, this is a disease which is made worse when you're stressed. So having an hour before bedtime to just wind down, no screens at all, read a book, have a warm shower, do whatever you do to wind down into your bedtime routine. Pop your bite splint in before you go to bed. The first few nights you wear the bite splint, you'll probably find it wakes up in bed next to you, but about 80% of people tolerate it well. About 1 in 10, it might make things a little bit worse. And so therefore you need to think about using something else. It's best to get a custom-made bite splint. The ones you can buy on the internet aren't as good as the ones that will be made by your own dentist. So there's a lot written in the literature about jaw exercises and whether it relates to an improvement in temporomandibular disorder. This evidence is based on very tightly controlled studies, usually in the Nordic countries, where patients were seen on a regular basis and the exercises were gone over and over again. By and large, you should consider this an injured joint. And so if you'd injured or sprained your ankle, you wouldn't go out and walk on it every day. So one of the things I say is rest the joint. If you end up seeing a physiotherapist, they will go through the sort of stretching exercises you could do. But any form of simple exercises that you might get over the internet, I haven't really seen any huge benefit of patients that come to see me after they've been doing those. So referral onward by the dentist is somewhat dependent on what the dentist has already done. Routinely, I would suggest that you need at least 6 weeks of conservative measures of rest, anti-inflammatories, muscle massage, and a bite splint. And if you've seen no improvement at that stage, I would suggest referral on to a TMJ specialist in oral and maxillofacial surgery. The NHS England guidelines and the Royal College of Surgeons guidelines would suggest this may be up to 6-month period, but I want to see patients earlier in the course, particularly patients who have got severe restriction of mouth opening, because they get a better outcome with earlier intervention than patients who are left for months on end.